It's time for a health report, and joining us now is Africa 54 health correspondent Lino Medu with a look at the global health highlights for 2016. Lino.
That's right. Well, the threat of Zika dominated health news in 2016 as the mosquito-borne illness caused an epidemic in some countries in the Americas and the Caribbean. The World Health Organization declared recently that Zika no longer represented a public health emergency. Advances in HIV/AIDS, tuberculosis, and malaria made headlines, and more countries are eliminating neglected tropical diseases like lymphatic filariasis, blinding trachoma, and schistosomiasis. But experts raise the alarm on the increasing rates of non-communicable diseases like cancer, hypertension, and obesity globally. As Africa was a year away from being declared polio-free, 2 cases of wild polio were reported in Nigeria, putting a dent on progress made. A yellow fever outbreak in Angola spread in few other countries, including the DRC, and raised the alarm on the limited global yellow fever vaccine stockpile. Earlier this year, the WHO declared the Ebola outbreak over, and just recently, a new vaccine to protect against Ebola was proven to be 100% effective in a major study in Guinea. Joining us live via Skype from here in Washington, D.C. is Professor Gostin, Faculty Director of the O'Neill Institute for National and Global Health Law with Georgetown University and Director of the World Health Organization Collaborating Center on Public Health Law and Human Rights. Professor Gostin, welcome to Africa 54.
Thank you. I'm delighted to be here.
It's great to have you. Let me start with the very latest development, which is the successful Ebola vaccine trial. What is your take on, what is your reaction on this?
Well, my reaction is that when the world really wants to do something, that we can make enormous gains in global public health. And Ebola was just the archetypical illustration of that, because if you think about it, at one point in West Africa, Ebola was spreading exponentially, and the United States Centers for Disease Control and Prevention was suggesting that we could have 1.2 million cases of Ebola. And the world was asleep. It didn't seem to care. It was another example of, well, an epidemic's happening in Africa, so it doesn't affect us. But then once the world did engage, we managed to bring the epidemic in West Africa under control. We invested in research, and now we have a very promising Ebola vaccine for one of the strains of Ebola. So it's a great success story, and the sad irony is that we should have done it a long time ago.
That's a good point. And now the WHO declared recently that Zika, to move to a different topic, Zika no longer represents a public health emergency. What do you make of this? Is Zika no longer an issue globally, or is there some more? Is there a reason to remain concerned with this disease?
Well, I think the World Health Organization has done a lot better with Zika than it did with Ebola, but I do strongly disagree with its decision to call off the public health emergency of international concern. I think it's too soon to do that, even though WHO has said that Zika continues to be a major worldwide problem. It didn't fit within the definition of a public health emergency under the international health regulations. But I think that it really makes people take their foot off the accelerator, and it's unwise, because we're now coming to the winter in the southern hemisphere. I mean the summer,
yes.
In the southern
hemisphere, yes.
Where you have the largest risks of mosquito-borne outbreaks. We have outbreaks in Singapore. It could move to places in South Asia. There's always the risk that it could reoccur in Africa. So I think this is not the time to say it's not an emergency anymore.
Okay, Professor Gostin, we have to leave it there. We will continue the discussion on the radio program shortly. Thank you so much for joining us.
Sure, my pleasure. Thank you.
And that was Professor Gostin. He is the Faculty Director of the O'Neill Institute for National and Global Health Law with Georgetown University. Now we